Before we begin, please know that some episodes include language that may be sensitive for some people. Welcome to another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll name River. It was her second pregnancy with me, and she had had a previous cesarean section for failure to progress in labor. This time she was wanting to have a repeat cesarean section, and she wanted to have a specific obstetrician, Dr. Dustin Costescu, who just happened to be the obstetrician who was working when she required her first cesarean section. Many midwives would consult with Dr. Costescu, as he was such a sweet person with amazing skills. I remember the first time I attended a cesarean section with him, and I watched him carefully cuddle the baby in his arms, looking at the baby with such a tender look on his face. I had to take a photo for the parents. During a cesarean section after the baby's born, we do delayed cord clamping for a minute, and that allows more blood flow to the baby. And that's why Dr. Costescu was cradling the baby. But for River's birth, she wanted Dr. Costescu to do something different. Something he started doing when requested and was appropriate and safe to do so. What Dustin the obstetrician started doing was lifting the drape up that hung down in front of the woman's chest, creating a sterile field. And the midwife standing at the woman's head with sterile gloves on would wait for him to place and slide the baby up towards the mom's chest. Then we would reach for the baby's armpits and pull the baby up to mom's chest. Once Dustin cut the cord, we would position the baby to be skin to skin with mom within moments of the birth. River also wanted her experience recorded as much as possible. So on the planned day, I strapped on a GoPro to my chest and pressed record. I was so excited to be able to record seeing the baby emerge from under the blue sheet. However, when I bent over to reach for the baby, the camera was pointing down. It wasn't until I stood up that we got to see some of the recording of the baby's birth. River was so happy to be caressing and telling her baby how much she loved her so quickly this time. Her baby was coughing and sputtering a bit. River asked, "Do you need to take her to see if she's okay? Need some suctioning?" Babies born by cesarean section do not get the vaginal squeeze. That vaginal squeeze ejects fluid from the bronchi, or the tubes leading to the baby's lungs, and sometimes they need to be suctioned with a small flexible catheter. But not this time. Within 10 minutes of the birth, the baby was wanting to nurse. I positioned her lying sideways on mom's chest, and she was sticking out her tongue, licking and looking for something instinctively. Mom's nipple was close by, and with a slight adjustment, she was successfully latching and began breastfeeding. That was one of the fastest times from birth to latching I've ever seen. Even Dustin was surprised to hear me say, "The baby's on the breast." So just to be clear, to slide the baby under the sheet is not something that should be done every time during a cesarean section. You wouldn't want to do that if the cesarean section was due to a concern for the baby, like a non-reassuring fetal heart, or if there was thick meconium, that's poop from the baby, that can sometimes be stuck in the lungs or the bronchi, and that baby would be at a higher risk in needing suctioning and perhaps assistance in breathing. Even after a long labor resulting in a cesarean section would be a reason not to do this maneuver. In fact, Dustin would have a discussion in the pregnancy for planned cesarean section that if the plan was to slide the baby under the blue sheet, if for any unforeseen circumstances arise, that plan would change. Some examples would be, mom suddenly felt nauseous or unwell suddenly, which could be a result of a drop in her blood pressure, which is not an uncommon event. Spinals or epidurals are done for cesarean sections, and the medication that is used for this sometimes can cause a drop in the blood pressure. Another reason that could change the plan would be if it was a difficult extraction of the baby due to size or positioning within the uterus. Or, for example, if mom started to bleed more than normally. When I retired, Dustin was the only obstetrician that was comfortable doing this maneuver. However, I did see another doctor start to cradle the babies as soon as she delivered them, which was so nice to see this sweetness passed on. Thank you for joining me for another episode of The Birth Portal.